All right, so this is part 2 for chapter 17, continuing on with our vitamins. So, water soluble vitamins continued on. So, B7 or biotin. This plays a role in many processes within the body, including cell replication. We can find B7 in peanuts, green leafy vegetables, liver, egg yolks, soybeans, and yeast. Indications for supplementation of B7 is obviously a deficiency of B7, which is typically associated with some type of altered absorption. So there are some individuals that have difficulties absorbing vitamins the proper way. It's called thalassemia, and that can lead to many other health conditions, just not being able to absorb the vitamins, even if they were taking a separate supplementation. B9 or folic acid plays a major role in the intracellular metabolism, the breakdown of homocysteine within the body, and is actually involved in the production of serotonin, which is a neurotransmitter found in our body. It can be found in green leafy vegetables, fruits, cereals, grains, and red meat. Indications for supplementation are obviously a folic acid deficiency. It is recommended for at least 800 micrograms of folic acid during pregnancy to help reduce the incidence of birth defects. So that's essential for the first 4 to 8 weeks, maybe 12 weeks of developing babies, because that is when all of the neurological parts are being developed. So a lot of babies that are born with what they call neural tube defects, which would be like spina bifida, anencephaly, missing of a brainstem, those things have been attributed to a lack of folic acid. So it's actually recommended that females of any childbearing age should at least take 400 to 800 micrograms of folic acid every day, just in the event that a pregnancy is unplanned. End-stage renal disease or kidney disease causes a reduction of folic acid because it is involved in the homocysteine levels. Chronic fatigue syndrome, depression is another indication. B12 or cyanocobalamin, which is the other name for B12, it is a coenzyme that is necessary for cell reproduction, normal growth, and red blood cell count production. It helps with energy, which is a huge drive for our bodies. It can be found in fish, milk, breads, and meats. Its intrinsic factor is it's produced by the stomach and is required for intestinal absorption of the oral form. So you have to make sure that you're getting the correct formulation. A lot of times B12 supplements are actually sublingual or chewable tablets because the B12 is highly unstable in the fact of when you take it in an oral supplementation, a lot of times it's going to be destroyed by the stomach acid. Supplementation indications would be a vitamin B12 deficiency, anemia, and end-stage renal disease. Vitamin C. So your B's and C's are your water soluble vitamins. So vitamin C, or known as ascorbic acid, plays a big role in the immune system function. It also works as an antioxidant. It can be found in citrus fruits, tomatoes, potatoes, Brussels sprouts, cauliflower, broccoli, strawberries, blueberries, cabbage, and spinach. Indications for supplementation would be a vitamin C deficiency, scurvy. Scurvy was actually something that really plagued in the early centuries, especially those that were on ships. So as they were starting to leave their mainland and search for new land, or if they were coming from Europe to America, a lot of these individuals on the ships ended up with scurvy because the fresh fruits obviously didn't last the weeks that they were on the ship, and so they had a very high rate of vitamin C deficiency. Macular degeneration, seasonal allergies. It helps, vitamin C helps improve iron absorption, and then protein metabolism in premature infants. It can be used for prevention of common colds. It can be used for the prevention of cancer and sunburns. So your fluid electrolytes and acid-base balance. So we're just going to kind of go through these a little bit quickly because this is really where we're just focusing on the vitamin portion itself. So there's two compartments of bodily fluids, so intracellular and extracellular. The human body consists of about 40 to 70% of water. The body water varies according to certain conditions, so weight, sex, and age of the individual, and then water deficit. So there are many different reasons why we wouldn't have enough water in our system: vomiting, diarrhea, edema, excessive sweating from a fever, large urine output, and acute weight loss. So signs of a water deficiency are dry skin, dry mucous membranes, wrinkling of the tongue, hypotension, which is low blood pressure, tachycardia, and lowered body temperature overall. So your IV fluids are what we use to replace fluids and electrolytes that are lost through dehydration, regardless of what the cause of dehydration is: vomiting, diarrhea, sweating. And they also use IV fluids to administer drug therapy into the body. So if you've ever been in the hospital and had to have IV drugs, pharmacy technicians will add that drug to a fluid solution: normal saline, which is sodium chloride, dextrose, lactated ringers. These are a vehicle in which they use the drug to be able to be administered directly into the vein. So electrolytes are molecular compounds that form ions when they're dissolved in water. They exist in the body as positively or negatively charged ions. Cations are positively charged ions such as sodium, and anions are negatively charged ions such as chloride. So typically your electrolytes are going to be measured as milliequivalents or MEQs. And these are not convertible to grams, milligrams, micrograms. They're their own entity. Just like units are, insulin is measured in units. You're not going to ever be able to convert units into milligrams or grams or anything like that. The same goes for the milliequivalents. Osmosis is the passive movement of water across the cell membranes to maintain equal concentration of the molecules on both sides. So your electrolytes: sodium, potassium, calcium, magnesium, chloride, phosphates. We do have some oral versions of electrolyte replacement. So potassium comes in an oral version, calcium, magnesium, but then they also come in an IV formulation. So IV potassium, we would do that a lot in the hospital when I worked in the hospital. There is IV magnesium. Something to be very aware of with IV potassium chloride, or the injectable version of potassium, is that it must be diluted and mixed well before administration. It must be given very slowly, so it's not something that can be ran at a very high rate or fast rate. The reason for that is potassium chloride is essential for our bodies. It's essential for proper heart function, but in certain amounts. High doses of potassium chloride are actually one of the medications that are used in lethal injection. So that's kind of the final drug that's given in lethal injections, because in high doses potassium chloride will stop the heart. Acid-base balance. So if you have too much acidity in your body or your blood, pH level is high, you can have a condition called acidosis. If you have too much of a base blood or non-neutral, because blood typically runs in the neutral range for pH. Anything that would be considered a base would be alkalosis. So let's see. Acidosis would be, so on a pH scale, the numbers are kind of reversed. So you're thinking, okay, the higher the number, then obviously that would be more acidic, when in fact it's opposite. So from 0 to 6 on the pH scale is considered acidic. 7 is your neutral zone. 8 to 14 is actually basic. So it's kind of flip-flop. Sometimes our brains have a hard time wrapping around that and how they distinguish that pH scale. Nutritional disorders is very common and can lead to a lot of hospitalizations for our patients. So it's a condition characterized, or obesity is a condition characterized by excessive accumulation and storage of fat within the body. There's an increased rate of obesity over the past few decades, especially here in the United States. And one of the main contributing factors to that is diet and lack of exercise. So causes of obesity, so environmental factors would be sedentary lifestyle. So, sitting on the couch, watching TV, not working out. A readily available food supply. So those are the choices we're making when we go into the pantry or the cupboards or the refrigerator, and we're pulling out cookies or things that are not healthy. Or if we're running to McDonald's or Burger King or Carl's Jr. instead of doing kind of a home cooked meal. Genetic correlation. So obesity was among first-degree relatives. Among first-degree relatives is a predictive of obesity in adulthood. And then psychological factors play a role. So a decrease in the release and sensitivity of hormones that signal the satiety of fat, so dissolving of fat, body ridding itself, and then that fat tissue begins to accumulate. Certain medical conditions and then medications can actually lead to weight loss or weight gain as well. So kind of the first line of defense would be lifestyle intervention, so reducing your caloric intake. Restrictive diets are not often sustainable, so that's saying a lot of times, we have those New Year's resolutions and we're going to be on a diet and we're following this plan, but a lot of times we fall off of that. And then an increase to caloric expenditure. Bariatric surgery is an option for individuals. One thing that they have to really watch with the bariatric surgeries is ensuring that they're getting enough of the nutrients, because the amount of food that they're eating is declined. So most of those patients do have to be on some type of vitamin supplementation. Lipase inhibitors or fat inhibitors would be orlistat. These drugs work by binding to the gastric and pancreatic lipase in the intestines, which prevents it from breaking down the fats into its absorbable form. And then the fat will then pass through the intestines, then it will be excreted in our stool. Malnutrition is defined as a lack of adequate nutrient intake to supply our basic metabolic needs. It's due to an overall lack of calorie or protein consumption, or it can be due to a deficiency of a specific micronutrient. So again, there are a lot of different contributing factors to why an individual may not be getting the full nutrition that they need. It could be lifestyle change or choices that they're making, but there also could be underlying medical conditions that are preventing that as well. So we could, so let's say we have an elderly patient that is not able to chew their food and swallow very good anymore. So we can do what's called enteral nutrition. So it's a method of feeding a patient liquid nutrients through a tube that is inserted into the GI tract. They can give it as a bolus, meaning a large amount of liquid certain times a day, or they can do a continual feeding where the pump runs 24 hours a day. Indications for someone to be fed this way would be a bowel obstruction, short bowel syndrome, Crohn's disease, and then the inability to swallow food. Enteral nutrition should never ever be administered through an IV line. So these lines are going to be placed directly into the GI tract, into the stomach. A lot of times they're fed through the nose down into the intestinal tract or the stomach. So there's a couple different ways. It actually shows you a picture on slide 50, what an NG tube looks like, and that was actually placed. An NG tube is going through the nose, and a G tube would be placed directly into the stomach. Parenteral nutrition is the method of feeding the patient through the IV. So we refer to that as a TPN, or a total parenteral nutrition. We actually make these in the pharmacy. They have to be made in an IV hood in a sterile environment, because they are going through a central line or a peripheral line directly into an artery or directly into a main vein. A lot of times, again, patients who have certain types of cancers, patients who aren't able to swallow, sometimes patients who have psychiatric conditions such as anorexia, pancreatitis, other different types of diseases would require a TPN. So if the patient is not eating by mouth, then we have to figure out a way to get them their nutrients, and parenteral nutrition, or TPNs, is another way to do that. When we are preparing the TPNs, we are following specific orders. So those orders are done daily, and the doctor is involved, the pharmacist is involved, and the dietitian is involved. So they work together. They're looking at things like the patient's blood work, what's coming back, what are they lacking, and the three disciplines will determine what is actually going to be put into the TPN for the patient. Poison and antidote. So the greatest populations at risk for poisoning are obviously children, older individuals, elderly. Sometimes it's because they have a hard time seeing. Sometimes it's due to mental incapacity, and then occupational exposure is actually a high on there. So concerns regarding ingestion. So the biggest thing is eliminating the poison from the GI tract to prevent its absorption. So the faster we can get it out, the less time it has to absorb in our body. That's one thing that activated charcoal is used for. Obviously, the poison control hotline is a huge deal that runs all the time, 24 hours a day, 7 days a week, and allows anyone to call in and ask questions, and they will give information on if they're able to identify what the potential poison was and what steps should be taken. Flush with water, drink this amount of water, take a shower, or visit the emergency room. Decontamination is defined as removing as much of the ingested poison as possible. So again, strategies on that are emptying the stomach, which is inducing vomiting, or using a gastric lavage, preventing the absorption, which is where activated charcoal comes into place, and then inducing the vomiting, which they can use a couple of different methods to induce vomiting. Ipecac is something that they've had for years and years and years, and used to be available over the counter, and they would give that to especially children. So prior to the 1970s, when children were at higher risk for getting into their parents' or grandparents' prescription medications and taking them, because if you've looked at any type of tablets, a lot of the tablets are very colorful, and they can very easily be mistaken for candy. Antivenin. So antivenin is huge. If you work in a hospital, you're going to have access to antivenin. You are going to be preparing antivenin, especially here in southern Arizona. It is used, it's a material that is used to treat the poisoning by animal venom. Snake antivenins may require a high dose. Serum sickness is a common side effect of using antivenin. It's effective against all pit vipers. You need to have epinephrine, an IV antihistamine, and hydrocortisone available when you're giving that, just because, if you've never had antivenin before, you want to make sure that you are not allergic to it, and then these drugs actually help the antivenin work in the way that it should. Spider bites, so black widows. We have those here in southern Arizona. Usually supportive care is effective for most healthy adults. The antivenin is actually indicated for patients under 12 years old, or patients that are over 65 and have certain medical problems. The brown recluse, dapsone is used to preserve the skin around the bite. So brown recluse bites actually cause necrosis of the tissue that spreads, which is the venom is killing the tissue around the site of the bite. Scorpion stings. I've never had the pleasure or non-pleasure of being stung by a scorpion, so thank goodness. But again, something we have here in southern Arizona, and there is antivenin to treat that. Emergency procedures, so code blues. This is a universal term that is used in every facility across the United States. You will hear them call a code blue, and it is initiated when a patient is in a life-threatening situation, such when a patient's heart is stopped or their breathing has stopped. We in the pharmacy prepare the trays with the drugs, the emergency drugs that go inside of the crash cart. So it's going to be things like dopamine, epinephrine, amiodarone, which is used for heart arrhythmias, those type of things. Excuse my husband. Sorry. Sorry about that. So etomidate, which is used for intubation. So etomidate is actually a drug. It's a muscular skeletal drug that is used to treat patients, to paralyze them, to be able to intubate them and begin breathing for them. There's Narcan that's in there to help if the patient has stopped breathing or their heart has stopped due to an opiate overdose. So there's a lot of different medications in there. The last piece, and we're just going to kind of cover this real quick, is bioterrorism. So bioterrorism is defined as an attack or threatened attack by terrorists where the weapons are biologic agents and emerging infectious diseases. So there's two type of agents: disease-causing microorganisms, which means they would grow in the environment or in a living host, and then toxins, which are the product of living organisms and they do not reproduce. Bacterial diseases with the potential for bioterrorism, anthrax, we saw that heavily after 9/11, if any of you are old enough to remember that. After 9/11 happened, there was a period of time where certain individuals were receiving mail with anthrax-laced powder inside of it, and that went on for some time. The plague is something that can be used, and then smallpox. Smallpox was actually used as a form of bioterrorism early on with the indigenous population here in the United States. It was infected blankets were delivered to Indian reservations or tribes, and they were infected with smallpox. So we do not vaccinate against the smallpox in the United States anymore. The only individuals who are getting smallpox vaccinations would be our military personnel who would be traveling outside of the United States. I know Mexico still does smallpox vaccinations, but at this time we have eradicated smallpox from the United States, and so they are no longer giving those vaccines. Your role as a pharmacy technician is front line of defense, so dispensing drugs that are going to be helping these individuals get better, maintaining their profiles, making sure that their allergies are up to date, because if it's a biological weapon such as anthrax and the go-to drug for that is Cipro, but if they have a Cipro allergy, we have to find something else that they can take, and we run the risk of them dying or whatever the result would be from having the allergy to that. And we have finished chapter 17.